advice about conditions, if they have any, and about COVID-19 from their doctor or provider we can connect them with if they don't have a doctor. So what should the patients do if they have COVID-19? So per the CDC, they should stay home for 7 days after their symptoms start and at least 3 days after they've recovered. So what does recovery mean? Recovery means that you have not had any fevers for 3 days without using fever-reducing medication such as Tylenol, and your respiratory symptoms have improved. One thing to note is that we are finding that patients who are infected with COVID-19 can still transmit the virus for a number of weeks after someone's been infected. So we would also instruct the patient to continue to wear a mask when they're around their friends and family for at least 2 to 3 weeks. I'm going to go through this, the home care, in a little bit. Let me go back. No, we can do this one now. Next, we will tell them that there are no specific treatments for COVID-19, so there are things that they can do to take care of themselves at home. So they should rest, drink plenty of fluids, perform hand hygiene, so that's washing with sanitizer or with other, with soap and water. And avoid touching eyes, nose, mouth with hands. Clean and disinfect frequently touched objects and surfaces. Additionally, if they're at home and they're living with other people, they should wear a mask. And we'll talk about that a little bit more further down. If they can, they should separate themselves from their family members if possible. We know that in certain communities, a lot of families are living together. They're doubled up or tripled up. Therefore, we can recommend that they either stay somewhere else or that people who are at high risk stay somewhere else during the time that they're recovering. And again, they should wear a face mask when they're at home, and other people in the house should also wear a mask. Another thing that you can do, or that people can do, is install an air vent filter, a HEPA filter. It's a 1900 level, so 1900 HEPA, and that 1900 HEPA filter can be placed on the intake grill of the air conditioning or heating unit that pulls air from inside the house. And you can also place it in the grills where the air comes out. If you need help, you could ask someone in your family who might be handy, but usually just going to Home Depot or Lowe's, you can ask them what's the best way to remove the grill and place the filter, and they'll be able to walk you through it. Next, you should inform your close contacts, so people that were in your house, intimate partners, caregivers, if you went to a certain store and spent time there without wearing a mask. If you were with those people up to 2 weeks before, they could have gotten sick, so you should inform them. And then again, we recommend that people stay at least 6 feet to 15 feet away from someone when they're in home isolation. And if it's not possible, their 14-day quarantine period will have to restart from the time of the close contact. That is for the people who were in close contact with someone who tested positive. And again, those in the house who are close contacts should wear a disposable mask and gloves if they help to clean your room or help you with any of your bodily secretions such as sweat, saliva, sputum, nasal mucus, vomit, urine, or diarrhea. And they should remove and dispose of their gloves first, wash their hands, then dispose of their face mask and clean their hands again. And they should put a mask back on when they're in the house. And again, putting in that 1900 HEPA filter will help keep other people in your house from getting COVID-19. Also, some people asked, well, is kissing okay if I have COVID-19? Well, just think about it when you're sick, when you have the flu, or you have a cold. Sometimes, yeah, you might kiss someone, but then you could still get sick. So it's recommended that if you know that you're sick and you know that you test positive, you should do your best to refrain from French kissing. So again, we want people to stay home so we can go through this with them and talk with them in a conversation. This doesn't have to be read word for word, but just make sure you hit the critical points. The critical points again are that they should stay home for at least 7 days after the symptoms first appeared, and at least 3 days after they've recovered. And also, they should refrain from going to work or other places. If they need to meet someone at the door, they should wear a mask that covers their face and mouth and maintain 6 feet of social distance to avoid physical contact. Cover coughs and sneezes. Avoid sharing personal household items like dishes, cups, eating utensils, towels, bedding, or avoid touching your pets because we're seeing that pets can get infected and we don't want them to get sick. And then of course, we want you guys to be safe at home, so make sure that you're cleaning high-touch surfaces such as your keyboards, your laptops, your phones, bedside tables, and if you keep like a little trash bag with all your, if they keep a little trash bag with all of their tissues, they want to make sure that they dispose of those a couple of times a day. The other thing is people can keep their windows open in their home so that air flows through the home, and there's less of a likelihood for the virus to stick around the house. It can go out, and once it goes out into the air, usually the virus dies because it's hit with UV light from the sun. Then again, we want to tell patients who didn't have the priority symptoms that were listed above, if they start to develop difficulty breathing, which is if they walk a short distance from the couch to the refrigerator or from the couch to the bathroom, if they're unable to keep water down or any other liquids, if they're too weak to stand, they should not stay home. They should call 911 and go to the emergency room. And they should tell the operator that they tested positive for COVID-19. If you have comorbid conditions, people can be at higher risk. And so you want to make sure that you call early and not till you're feeling so weak that you can't stand. You really, if you're feeling some difficulty, call early. It's not a bad thing. You're not going to crowd the ER. You're not going to be a trouble to anyone. But it's important that you get checked out right away, because what happens is the body can compensate for a little while, and then it can't compensate anymore. And so we're seeing that patients compensate and then they decompensate pretty quickly. And so don't wait till the symptoms are really, really bad. Don't stay home, and call 911 or call help from a family member. But most importantly, I would just say call 911. And then you can tell them that you're having chest pain and difficulty breathing, and that that the patient was tested positive for COVID-19. And then we're going to ask if we can call them back, to follow up on them, to check on them and see how they're doing. And then if they say yes, then we can make a note of that and call them back in a week or so just to see how they're doing. If they have additional questions, we can write them down here. If there's additional notes, we can write that here. And then if they let you know specific information and needs that they have, if they're a minor, if they're experiencing domestic violence or homelessness, we can help connect them to different services. And so we've already been speaking with some people who are testing positive who've mentioned these things to us. And so we want to be able to give you guys the resources, and we'll have a sheet that you can refer people to. Then when you're done with that, you just click submit or save and return later. So that's another, and this is your return code. We'd have to write it down to go back to the link. All right, well, that's it. I just want to thank you again for helping to do this very important thing, which is calling patients back who test positive for COVID-19. They may ask you many questions, and I thank you for your patience and your kindness as you speak with them. Have a great day.